Well, once again, we'd like to welcome you in today's edition of the Morning Call. Kenya will import 100 doctors from Cuba following a deal it signed with Cuba last year. The move comes after President Uhuru Kenyatta's 3-day official state visit to Cuba, where he sought cooperation in health, sports and culture. According to this agreement, each of the 47 counties in Kenya will get at least 2 Cuban doctors, while 50 medics from Kenya will travel to the Caribbean country for specialized training. The Kenyan government believes this move will help improve delivery of health services in the country by filling in the existing doctor-patient ratio gap in country hospitals.
So we're talking about a lack of resources, indeed. But not only that, 2 Kenyan governors who were part of a delegation sent to Cuba explained that it's now difficult to convince doctors to work from far from major urban centers. So obviously the news was not well received by everyone, especially the Doctors' Union. The organization said the government would be better to give work to Kenyan doctors first before importing from abroad. According to the union, about 1,200 practitioners are looking for work.
Selon le syndicat, environ 1200 praticiens chercheraient un emploi alors qu'il est au Kenya.
Well, we'll speak about this with Dr. Nelly Bosire, a doctor and activist who joins us from Nairobi, Kenya. Dr. Bosire, we thank you very much for joining us in the program today. But can we now say that the move to import doctors is going to help solve an already existing problem?
Well, the health worker problem in Kenya is multi-pronged. And just to bring in extra doctors isn't exactly a solution. It's not necessarily going to be an immediate solution. The agreement signed between Kenya and Cuba is meant to bring in workers, specialists who are supposed to work here, train the locals, and have some sort of bilateral agreement where we have local doctors going to get trained in Cuba. But really, where as a country where we sit right now, our immediate issue is not necessarily that we do not have doctors to work. We do have about 1,200 doctors currently unemployed in this country who are trained both at general practitioner level and specialist level. So I think the challenge we're having with understanding this agreement where you're bringing in extra doctors is to tell us what exactly is their role when we haven't even exhausted the capacity we still have in the country. In terms of training, well, maybe not. We still have capacity to train in Kenya. We have been training specialists for many years. We've been able to train even sub-specialists. Probably the investment would make more sense if we were expanding our training capacity locally, because we are able to train. We probably just need better finance so that we can be able to increase the numbers of specialists that we are able to train annually. So I think if we're looking at trying to achieve universal health care, which is probably what the president was looking at, then this may not necessarily be the best advice move that we would want to take. That might not be what would be most beneficial to us as a country.
Well, Dr. Nelly, in some African countries, the reality is that there are not enough doctors for a whole population, and this type of agreement seems to be a good alternative.
If Kenya didn't have capacity to make its own doctors, then it would be. But Kenya is a country that is able to churn out about 1,000 doctors every year right now. And as much as our ratio will not be good, we have the capacity to change that ratio internally, which would probably be more sustainable and more cost-effective. We already have trained doctors who are certified to practice in this country, who will not have challenges that we expect the Cuban doctors to have, like language barrier and cultural, difficulty in fitting into different cultural situations. So why would we invest in bringing foreigners when we already have local capacity here that we haven't yet exhausted? So that might work in other African countries, but in Kenya that is really not a sensible investment, if I may say so.
And the challenge of lack of infrastructure for quality training appears to be a major obstacle. Is this a big issue in Kenya? Are there enough qualified doctors? And if this is not the case, what do you think should be done to have more doctors in the country?
In Kenya, lack of infrastructure to train is not really actually a problem as such. We have lots of what we would call level 5 facilities that are adequate for training. What we require is a bit of investment in them to turn them into training institutions. But in terms of training, for instance, especially, these facilities are fantastic for training. They have large patient volumes. They have a wide variety of illnesses, which are very good for the learning doctors to actually work with. And for us to convert them into teaching hospitals would probably cost a whole lot less than trying to bring in foreign doctors to come and work here as expatriates, which means that they're going to be paid a lot more money that could be better invested, essentially. In terms of infrastructure, we are moving along now. We're able to train. We've been training specialists for years. We actually, for the level where we're training super specialists, in a country where we're training our own oncologists, our own renal physicians, our own infertility specialists, it doesn't make sense to say that we are a country that needs to import ready-made manpower. No, we're not. We really are not there, no. We would prefer if that money was put into improving hospital infrastructure, availing drugs and things like that so that these patients get better care while specialists are training in the same institution. That's definitely a more sustainable solution.